But again, there are some people that are hesitant, and that's understandable. This is new. It's yet another phase of the pandemic that everyone is having to really, grapple with and come to terms with. Early studies are showing that there are certain groups of people who are more likely to have hesitancy about being vaccinated. This includes women, persons under age 55, persons that are from low-income backgrounds, as well as those who are not college educated. We also see that rural residents, as well as people who are in Black or Latina communities, those folks are more likely to have hesitancy. Next slide. Some of the reasons people will identify for why they're saying, I'm not sure I want to be vaccinated or not. Some people will tell you it seems rushed. The vaccine came too quickly. People may question whether it's effective, although we do know the studies have shown that these vaccines are in fact highly effective. Because it's rushed and because it was done quickly, people may feel like they can't trust it, perhaps the vaccine is not safe. They might be worried about side effects or long-term effects. That's one I hear a lot when I talk to people who are hesitant. They say, well, what's going to happen, 2-3 years down the road? Is this vaccine really safe? And lastly, I think we can all kind of sympathize with this. There's that sort of feeling of it's become too political. And, for that reason, people are just like, I don't want to be involved in this. Next slide. So what do we do about that? I think there are some very real, practical things we can do to try and address legitimate hesitation. Number one is to be respectful and really understand people's concerns. But it is important that we don't just sort of, run over people and ignore their concerns. People have the right to be worried. They have the right to be afraid. So rather than, arguing or sort of becoming defensive, I think we want to try and really focus on what people are feeling and what kind of information we might provide to help them work through those concerns. One of the first things you can do is provide written material on how effective the vaccines are and how safe they are. I would urge you to check out the CDC's website. If you just Google CDC COVID vaccine, it will take you to their section of their website on the vaccine. They have a wealth of information written in very simple terminology and available in a variety of languages. So you can use that to help educate staff members, clients, participants, family, friends, whoever you're working to educate.